Hi, my name is Kelly, and this is Component 7, Decision Making and Communication, part of SIM 415. So the first question is to define two different approaches to communicate the staffing schedule change process to the department and who is involved in conveying this information to the staff. As a nurse manager, one way to communicate a schedule change to my employees would be to hold multiple face-to-face staff meetings on day and night shift with the whole hospital management team present. It's important to show employees that not only the nursing staff, but the whole hospital leadership staff is on board with the upcoming change. These meetings would be held 3 months prior to implementing change. That way, we're able to take in staff feedback and make any necessary changes. The use of symmetrical communication will be the communication strategy of choice. This type of communication fosters an environment of two-way communication between management and employees, along with the expectation of openness and empathy. Employees will play an active role in rolling out this change. Nurse managers and other leaders will be able to identify any resistance to change with time left to talk to employees and do their best to change parts that they can. A second approach that could be used to communicate a schedule change that may be more accessible and realistic for employees to attend would be to hold multiple live Skype sessions, still with all the nursing staff and all of the hospital management team present, to convey the same message as we would face-to-face. A possible benefit to this would be at the end of the session, after questions and concerns, employees will be given a blank anonymous feedback section that comes up on their screen where they can voice any concerns anonymously. This may prove to show more feedback, as some people may be uncomfortable with the face-to-face confrontation. This Skype meeting will be kept available for all employees to view at any time at their own leisure during the next 3 months, so everyone and anyone can watch and give feedback before the change is rolled out. As mentioned above, all nursing staff, supervisors, managers, along with hospital leadership, will be involved in implementing the schedule change. Human resources will also be highly active, helping to implement the new schedule and deal with any accommodations that the staff may be requesting. The nurse manager, of course, is essential to keeping an eye on the employees to see how the new schedule is working for them. A staff nursing schedule committee can also be made for employees to voice concerns and even to vote on different ideas like how to handle who works what holiday. Consistent engagement with staff is going to be key during this time of change to ensure that the staff is fully supported. The second question is, what conflict management style and communication technique would I use to address a group of angry employees that present to my office? So collaboration is my style of choice for group conflict management. This style works best in the hospital workplace between nurse managers and staff nurses when you are trying to maintain positive outcomes in long-term relationships. I will let the employees know that I want to hear what they have to say. I want to hear what they're angry about. I'll let them speak first. Then I'll acknowledge their concerns and feelings before I speak. After that, I'm going to speak my part, which is going to include my personal views, hospital views, protocols, etc. Then we're going to collaborate together to come up with a resolution that can work for both parties. It's important, if it's nurse manager versus many, to be assertive, cooperative, and make sure everyone is heard and that what everyone says is validated. If the issue is not solved with me, then we'll go right up the chain of command for more assistance. The third scenario is, what conflict management style and communication would I utilize to address one employee who's complaining to other employees and patients on the unit? So going about this at first, my style is going to be competing. This is an urgent matter, especially since the employee is voicing concerns to the patient. When sitting down with the employee, first and foremost, it's going to be made known that voicing complaints to patients will not be tolerated and must stop immediately. The reasoning behind this is because the patient is not responsible for hearing these complaints. This puts the patient at risk of more stress, and this is a time where they need to be healing. After firmly stating the unacceptable behavior, I'll switch back over to a collaborative approach. I'll let the employee talk to me. I'll let them know that I want to hear their concerns. I will also ask them how we can break these negative feelings and come to a conclusion that we both win. After the employee lays it all out, I'll acknowledge their feelings and concerns and attempt to come to a mutual agreement because I care about our long-term work relationship. The fourth question is, how would I evaluate the effectiveness of the communication approach used for conveying the staff schedule change to employees? So one way is to have an open door policy. Staff can come anytime, voice their concerns, give feedback. I'm always going to have an open door. A second approach is to be observant on the floor. The nurse manager needs to be watching, listening, and assessing employee engagement levels. Also, initiating conversations with the staff. Don't wait for them to come to me. I'm going to go to them. I'm going to ask them, how are you? How's it going for you? Do you feel as though that this change was communicated to you well? And also, I would send a survey around to all employee inboxes, asking just a quick 5 questions about how the communication approach, how they felt the communication was done, and some questions to make sure that they understand the staff schedule change that's going to be occurring. And of course, I'll leave, they can put their feedback in there as well. And I think all of these together will evaluate how effective the communication approach was.